Hey, it's 9:38 now. When you feel pain in your wrist or maybe even your hand, you may try to shrug it off, but beware. It could be something serious. We're going to talk about that when we come back. 18 minutes before 10 o'clock now. Here's a question for you. How do your hands feel this morning? You know, when we think of pain, normally we may think of our knees or our backs, but our hands are a prime spot for injury, even arthritis. Dr. Mark Warburton is a hand surgery specialist who joins me now to talk about this. Good morning.
Thank you. Good morning. It's nice to be here.
So first of all, if you do have, say, aches in your hands, how do you know, or a hand, that it's something to see a doctor about?
Well, if you're in athletics and having problems, then you feel like you need to see somebody. Really, it's the pain and swelling is really the primary thing. And if you take over-the-counter medications and they don't help you, and swelling persists, or you notice any kind of clicking or locking, which we would have with tendonitis, then you need to see a physician.
Can you have a fracture and not really even know it? You just have pain?
Very, very true. That happens a lot. And actually, we'll have children come in, adolescents, and the parents don't think they have a fracture, or even an older person, because their finger will get swollen and get a little blue, and they're not having a lot of pain. It seems to move well, but then they come in and see us and they have a fracture.
Does osteoporosis or osteoarthritis at all add into this? Absolutely.
Osteoporosis is really getting the recognition and the research that it needs, because as we know, women that get older, postmenopausal women, and even younger women who are having osteoporosis, they're more prone to fractures. Absolutely. 50% of women who have osteoporosis are going to get a wrist fracture.
I was going to say wrists. Are wrists pretty much a common area?
Very common. It's the most common fracture in the upper extremity.
Really?
Yes.
Wow. And so for like maybe even some older folks who fall and they try to catch themselves with their wrist, be wary or understand that, you know,
absolutely.
Could be a problem.
Yeah, that's what usually happens. They're outside, they've gone to get the mail, or they're walking their dog and they'll trip and fall, and they'll get a wrist fracture, it swell up, and of course they need to go get it checked.
And you brought a hand with you to show folks, right?
Yes.
Some of the things that you can do to like a wrist fracture there?
Right. Actually, a wrist fracture occurs at the radius bone. There's two bones in the wrist. It's the larger bone, just above the wrist joint itself. And most of them are treated just with closed reduction, which means manipulation, and then a cast. But greater than 50% require some type of surgery. Now, there are many different techniques and implants that you can use to fix that, this being one. It's called an intramedullary nail.
Wow. And you put that in there and it stays?
Yes, that's correct. It is permanent.
Will it set off the metal detectors at the
Usually not. Okay. Usually not. Yeah.
All right.
Right.
Thank you so much for joining us today, Doctor. It's been nice to talk to you.
Well, thank you very much. Pleasure to be here.